All right. It's getting a little past the hour. I'm going to go ahead and get us started this afternoon. I want to welcome everybody to our annual Black History Month celebration. I'm very excited today because we have a great group of panelists with us, both here at MUSC and at Prisma Health. So we're excited to hear their insights and their wisdom for all the faculty, staff, and students. Let me begin with some introductions. We're very fortunate to have Shayla Bethea with us. She is from the class of 2014. She was our first honor graduate that year, and she currently works in informatics at Prisma Health. Welcome, Shayla. Good to see you again.
Thank you, Dr. Hall. Good to see you all.
All right. We also have with us Phillip Singleton, who is from the class of 2015. He is currently the pharmacist-in-charge at our Medical University of South Carolina, Ashley River Tower Outpatient Pharmacy. Phillip?
Thank you, Dr. Hall. Hope everybody's doing well. I'm glad to be here.
Thank you for joining us. And last but not least is Bernard Best. He is our class of 22 representative. He did his PGY1 at the University of Utah and then came back to MUSC and did his PGY2 in ambulatory care. He is currently still at MUSC working in the RENA Grant Sickle Cell Center. Welcome, Bernard.
Yeah, thank you for having me. Thank you for the introduction.
All right. What I would like us just to kind of have each kind of speaker kind of go through these questions we have just to share. We will be monitoring the chat, so anyone online with us today, please feel free to add in any questions, and we will be glad to add those to that. But we wanted to kind of just begin with, could you share a little about your journey into the field of pharmacy? And we'll let ladies go first. Shayla?
Of course, of course.
Sorry about that.
No, you're fine. So as far as my journey into pharmacy, I always tell people it was God's plan, all God, because of how I guess the events worked. But I knew absolutely nothing about pharmacy until after I graduated from college. Growing up, I always just knew I was going to be a pediatrician. So I had tunnel vision, and all through high school, all through undergrad, I just focused on going to med school. And then graduation year, I realized that was not the path I wanted to take. So I had a couple of years where I entered the workforce and was just living life. And then God would have it that my mom, in addition to a couple of other things that occurred, but she was a business consultant for decades. And actually ended up turning back to consultant a few years later, but she temporarily stepped away from that field to work at Rite Aid's district office. I don't know if anyone still knows what Rite Aid is, but she worked at Rite Aid's district office, and she suggested that I look into pharmacy. So I had just had a baby at that time, and so when I was ready to go back to work, she was able to help get me a job with Dr. Cassandra Fleming at the Rite Aid on Garner's Ferry in Columbia, South Carolina. And so that's how I was introduced to the world of pharmacy. and I fell in love with community pharmacy. Dr. Fleming was amazing. When I moved to Charleston to attend MUSC, I worked with Dr. Lisa Cords, and she was equally amazing. And so I just knew that I was going to do community pharmacy all throughout pharmacy school. Graduated, started working with Walgreens as a community pharmacist. But then a couple of years later, I decided to pivot and transition to hospital pharmacy, just to, I guess, get more to. I never say negative things about community pharmacy. I know it's stressful for a lot of people, but I think it takes more of a different mindset to be in community pharmacy, where you have to have, I guess, business mindset plus a clinical mindset and several other factors that go into it. So, sorry, I'm long-winded introduction. I'm gonna let you get to it, but decided to transition over to hospital pharmacy, and was working in the operations area. And then 2 years later, transitioned to my current role, which is pharmacy informatics system support, where I help to facilitate change management processes and maintain the automation for our system. But brief introduction.
Wonderful. Well, thank you. Phillip?
So pharmacy has been like involved me for the last, I would say, 20 years. I got my first start working in a CVS in North Charleston on the corner of Montague and Mixon in my community of Liberty Hill, and I was I was brought along as a high school teenager, and I graduated from high school. My pharmacist Terry Timmerman and Robin Lambor, or Robin Marcinko, they graduated class at MUSC as well, way back when. And they kind of guided me to where I'm at today. And without them, I probably wouldn't be here without them. Um, they pushed me, they taught me things, got me interested, and I took a non-traditional route. I actually went to school at Trident Tech. So I did my 2-year program there first, and then MUSC. And I always tell people, I didn't get in on my first time. As a matter of fact, I remember speaking to you, Dr. Hall, after my first interview to try to get in for the class of 2014. You told me what I needed to do, and that's what I did. And so that's how I got into pharmacy. Took a lot of prayer, a lot of goodwill. I was working at CVS for the past at least 19, 18 years, since 2004 until 2022, 2023. I left them and came over back to MUSC. I thought I'd never come back, but here I am and returned as the prodigal son. And kind of a full circle moment. My grandmother was a nurse at MUSC for about 40, 50 years. And so I remember coming with her as a child, coming with her, catching the bus, coming to MUSC, and her taking me, bring me up here, get her medication and all. So I'm back here at MUSC at River Tower Outpatient Pharmacy. We are open to everybody. And it's an experience, and I'm glad I came back because it helped sharpen my clinical knowledge. It really strengthened that an aspect of my schooling, and I'm glad I came back and seen what I've seen. I kind of like what Shayla says, I bring a knowledge of the business aspect of it, and I know how to run a business. This is more of a nice mold of both, so a business and a clinical aspect. So I'm really looking forward to the exciting things we're going to build for MUSC, and any way that I can help support the college, I'm here for.
Phillip, I remember, seems like just yesterday you interviewed. You were so blessed to have had you. Thank you. As for all of these great alumnus that we have. Bernard?
Yeah, I'll take it back to when I was in high school, and my guidance counselor, she like had this big piece of paper that had all these degrees on it, and pharmacy was one of the ones that she told me to look into. And so I started looking into all the different ones, and I just kind of decided like, hey, I'm going to go with pharmacy. Started working at Walgreens back in my hometown, Conway. And yeah, as I got into college, I went to Clemson, and I like started taking different classes. I took like anatomy and physiology, and and I took psychology. I think really what sealed it was like those classes, like when we got to like the neurotransmitters and then just the different parts of the body, I was like, I know I'm on the right path as far as my major goes. And yeah, as I like got closer to graduation, Dr. Hall would come to Clemson, and I remember meeting him at different like gatherings and learning about like the link between Clemson and MUSC, and so that was extremely helpful for me to know like there was a 3-in-1 program, and so I could still graduate from Clemson and come and have my first year at MUSC, transfer back. So it was a unique opportunity that I really liked about MUSC, and yeah, I applied, got in, and just going through like my first couple of years, I worked with Dr. Sterrett, going out and shadowing AmCare in the different clinics, and it was just something that kind of like stuck with me. I always thought coming in I was going to do community or retail, and just kind of being able to go in and see that like level of care, like having just direct contact with the patients for like a 30 or 45-minute visit, and then, just being able to be exposed to that over the years. Like once I got to my 4th year of pharmacy school, I tried to do like 4 or 5 AmCare rotations. I wanted to load up with as many as I could. And with like going into residency, I tried to find a residency that was AmCare focused, but also was like still had the traditional components. And so that's why I chose to do my residency in Salt Lake at the University of Utah. They also had the mountains, which I really liked. But then coming back to MUSC was big, just having my family and having like a wealth of knowledge. People like Dean Hall, Dr. Bragg, Dr. Starrett still here that I can like come back to and like bounce ideas off of as I like go into my clinical journey as like a practicing pharmacist has been really nice. But yeah, that's kind of how I got here, and yeah, super, super glad to be back and be a part of MUSC. And yeah, thank you for having me today.
Thank you. I believe my co-host joined us. Dorothea, out there? I saw you and then you disappeared off my screen.
I'm here, Dean Hall.
Okay. Do you want to introduce yourself and ask the next question?
Sure, I can do that. So my name is Dorothea Hoffler. I am a current P3. Um, I am also the co-president for the Black Student, one of the co-presidents for Black Student Union, and I also sit on the Diversity and Inclusion Board here at the College of Pharmacy. Um, and I currently work in inpatient pharmacy, but I do want to be a retail pharmacist after graduation. And I'll go ahead and ask the second question. The second question is, any unique challenges you faced as a Black professional? And I guess Miss Shayla can go first.
Sure. Um, so I guess on my current team, I am the only Black pharmacist. And so I think the main thing I have to do is be mindful of my emotions or try to balance. Keep my emotions in check, I guess, and not immediately jump to offenses or behavior as being race-based. But on the other hand, when things come up, to make sure I don't shy away from addressing them appropriately. And also, and this may just not necessarily be specific to being a Black pharmacist, but the working dynamics are different because I'm not in the same social circles as the rest of our team. So we have a different dynamic. Of course, a lot of other members are a lot closer because, they have relationships outside of work. So, not that anyone's necessarily unfriendly, but there's just a different dynamic in certain spaces. So I just have to recognize that and appreciate, I guess, the working relationships, but also not being offended when I don't have the same personal rapport that other pharmacists may have.
Thank you. And Mr. Phillip?
Um, It's a great question. I think there's challenges everywhere we go, and challenges in all walks of life. And like the main challenge, and this is in terms of not my peers, but in terms of patients, is the feeling that you're not qualified enough. And I think that'll a challenge that we'll face for eternity. I'll face it till I get gray and old in the face. And it's not related to as just being a professional, just being anybody in any walk of life. My mother worked for the city of Charleston, passed over on opportunities all the time. My father the same way, worked passed over. So I think when you get that professional degree behind you, it helps, but you're still going to have obstacles you have to overcome. And relating to Shayla's point, my experience is unique. Your experience is unique. All of our experiences are unique. So that can create challenges in the workflow. You know, what somebody says to you, how somebody reacts with you, or talks to you, is not the same everywhere you go around. And I think that as long as you have a sound upbringing, you can be allowed to. You can maneuver how you need to in regards to how you face these challenges. That's probably the strong challenge. Just not being people not thinking you're qualified enough. Um, your peers, they know who you are. You got the job. You're working here with them. Your peers should always give you that respect. They should always say that you're qualified. We know what you can do. Because if you couldn't do it, you wouldn't be here. Nothing is ever given. Everything we all got here, we had to earn. And so I really feel that strongly about that. I mean, that's probably the number one challenge I get in my 20 years. Even when I was a technician, that was a challenge. So I understand the challenge each step of the way. But it's something that I should take as a badge of honor because I got to go out and still do my job to save lives. And that's what we're all here trying to do, preserve life. So with that challenge in front of me, it's not a bad challenge right now. I can handle that. But just take some time to get used to. But yeah, that's probably the most unique challenge I've ever. It's not even unique. It's a challenge that everybody's gonna have to face one day. And I don't care where you at, which role you play, you're gonna face that challenge. When you walk in that room, they're gonna automatically assume, why are you here? Are you qualified to do the job? And they're gonna test you. And my goal is always be ready. And like I tell my patients, and I tell my coworkers, and I tell my family, I may not know how to get the job done now, and I may not know where the information is, but give me a couple hours. I'll find out how to do it. I'll find the information, and I'll get it done.
Thank you. And Bernard?
Yeah, I would definitely echo a lot of similar parallels to what Shayla and Phillip said. And I think, in addition to like race, I think age is also something that you can be discriminated against. And so I try to kind of like Shayla said, not always jump to it being like a race thing per se, but like many times, like when I was a resident and like I wasn't in like a permanent role where like people know me on an everyday basis. Like I would get often asked like, oh, are you a student? Or like, can I talk to like the pharmacist that's actually in charge? Or like I remember, yeah, that happened when I was staffing a pharmacy in Utah and I was like the only pharmacist working. And they were like, yeah, like can I like just talk to the pharmacist? I was like, I am the only one here right now. Like I wasn't the PIC, but I was like the only pharmacist like working. So I was like, whatever we need to talk about, like I'll try to do my best. And then if I can't get you the right answer, then like Phillip said, I'll look into it or like I'll get like with my PIC if it's something that needs to be escalated. But I agree. I would echo what Phillip said as far as like taking it as a challenge. I think like as a AmCare pharmacist, it's really rewarding to like have those patients that are sometimes skeptical. And then over time, like you kind of show them like, hey, like you can trust me. Like it takes time to build rapport. And like once I kind of built that with my patients, like over the course of 3 to 6 months, like they're asking for me like, okay, where's Bernard at? Like if the pharmacist isn't here, like I have a question for the pharmacist or so it's really nice to again build those relationships and have patients lean on you and kind of trust you over time. I think at this point in my career, it's unique because all my life, like I've essentially been the minority, whether it's been grade school, high school, college, like even my like professional like career leading up to like pharmacy school, like whether I was working as a technician, I've always been a minority. Like, and I think the first time like I realized I was kind of a different type of minority was when I was in like on a rotation in Montana, where everybody there was like a part of the native tribe. And so like I was still a minority, but it was just kind of a different perspective of being a minority. Like everybody around me wasn't predominantly white, it was predominantly natives. And so it was just kind of a unique experience to be there. And I mean, they totally embraced me. Like one of my best friends was from that tribe, and like we talk almost every day now. But I think now, like going into my professional career, like working in a sickle cell clinic, it's like totally different that basically all of my patients are Black. And so I think it serves as an advantage that they have like a different level of comfort with me. And it still takes some time to build trust with patients, even though like all of my patients are Black. And so I encourage them to be skeptical of me, be skeptical of everybody. Like I think it takes time to build trust. And so I tell my patients, hey, don't trust me. This is my first time you're meeting me. My job here is to like give you all the information and let you know what's available to you. You do your own research, and then we can kind of come back and come to some conclusions. But I think how we phrase things, and just giving patients time to like digest things on their own definitely does allow them to build that trust. Just from my experience, no matter like what my race is or what their race is, I think yeah, you still have to build trust with patients no matter what the factors are.
Thank you all for those great words of advice. Our next question is, how do you see the role of pharmacists evolving in the context of addressing health disparities? You're in 3 different areas of pharmacy. Could you just tell us a little bit about your thoughts about that? And we'll start again with the ladies first. Shayla?
Oh man. So I think because I'm not necessarily on the front line anymore, I depend on my colleagues who do have that interaction with patients. And one thing that, major thing that I noted were the Bernards that are now in that AmCare space. I know Prisma is aggressively growing our ambulatory care team, and I think that Bernard and all of our other pharmacists have a real opportunity to reach those populations and make sure that they're providing the education and the counseling. I always think that's key to helping close the gap. And then I'm also a big advocate for community engagement and doing things outside of work. My husband and I, we have a nonprofit and we try to do a lot of community give back when we can, and things with your church or your local community center. I think those are opportunities to educate, especially those patients that are nervous about going into hospitals or into formal healthcare spaces. Then those are the places that we can really help engage them and be more active and taking control of their healthcare.
Muted myself there. Phillip?
So I guess I just piggyback off of Shayla, which is really great. So in regards to addressing health disparities, and I'm on the front line kind of sort of with the patients when they come see me face to face. The main thing, and I think the health disparities and the economic disparities are somehow related. I feel as if patients don't feel comfortable getting paying for the medication, they're not feel comfortable getting it. So my team, and I got a great pharmacist behind me. If it's Sarah Pasosa, if it's AK, if it's Miranda with Bernard's class, we're always trying to help out patients, and in terms of getting this medication cost down for them. Whether we're looking at through grants, we're going through coupons, we try to eliminate that disparity, and then that'll bring them in even closer. Because you see somebody on your team trying to save you money, it feels that also trying to save a buck. That'll bring them into us, and when we get them into us, we can have more more genuine conversations with them. They know we're not here to trying to get them. We know we're trying to help them improve their quality of life. We're trying to make sure they stay vigilant in taking their medications. We're trying to make sure all these things go step by step. So I think once we build that trust with the patients, and yeah, that $10 coupon can build that trust and address that disparity, it'll bring them into us even closer. And then that's when you create patient bonds. I mean, 20 years, I know certain patients by name. They know how to come talk to me. They know where to find me. They know how we're going to handle the situation. They know that I got their back. And I think that's the main thing we need to address as pharmacists. And in the community pharmacy, And with Bernard, where Bernard's at, he's front line on this. He's actual in face with the patients. They're in the clinic. They're talking to him. They're getting his ideas. They're taking what he's having to say. He's not. They know he's not just trying to push pills to them to get them out of the pain crisis. Bernard's actually trying to help them make better lives, make better decisions. So I feel that once we can knock down these disparities in all of our fields. Even the same thing with Shayla, where she's looking at informatics, trying to figure out, okay, why is this trending this way with these patients on this side? We got to look at all these access to these disparities, and I think that we're going to be on the front line, especially community pharmacists. We're going to be on the front line of this because we're actually in the communities, and they're going to want to see this. Bernard's going to be on the front line. He's actually in the communities. They see him face to face. Shayla is behind the scenes, but what she brings to the table is going to help change how me and Bernard can practice. So all of us working together as pharmacists and as a team of medical professionals is going to help address these health disparities that we're having and we're currently facing. And hopefully one day we'll be able to eliminate all these disparities and try to serve the patients the best we can.
Thank you. Bernard?
Yeah, I think two things that that I've just kind of seen in my first. So I just got hired in July officially. Two of the biggest things that I would say that I lean on as far as breaking down some disparities are one is a service that we have here at the hospital. It's called Pharmacy Concierge Service. And it does a lot of things similar to what Phillip is talking about as far as like cost reduction, like seeing what coupons are available for patients, like what grants, like if there's any cost savings that we can get, like that's major for a lot of patients, especially if you're on like 5 medications and each of them has like a $9 copay. That can quickly add up over time for people that are on a limited income. And another thing that a lot of those the pharmacy concierge service can do is it'll sync up all the medications for the patients and it can ship them out to them, which is huge. A lot of patients can either forget to pick something up, or if it's not due, they just might say, I'm going to come back and get it later, and forget to like come back and get it. And if that's something like Eliquis or something like Plavix, that's essentially like you don't want to miss like a dose of it at all. It could be something that could potentially be life-threatening. And so just the ability to lean on them to like make sure like all the patients' medications are getting shipped to them, like, or sent to them on a reasonable like month-to-month basis is really helpful. I think something else that I have personally like kind of leaned into and grown towards as I've been in this role is like helping patients as far as like managing like just basic simple anxiety and depression. I think that's something that like a lot of people get like really like squirrely about when it comes to like antidepressants or helping patients with like anxiety or depression or talking through that. And just being in my role with like an attending physician, like we're able to kind of talk through it with each other. I can bring my pharmacy knowledge and she can bring her provider knowledge. And I think also we have a psychologist on our team that's here in the clinic. And so just being able to have those three components really makes me feel comfortable, like assessing like someone having insomnia or having like anxiety or restless thoughts or depression. Just being able to have like the three of us there and kind of talk through it, I think that knocks down a lot of disparities. I think, yeah, access to like mental health care is one of the biggest crises in this entire country. And so I think just being able to like offer the patients like the pharmacotherapeutic side of like talking about like how these things work and what to expect or what not to expect, just helps them like know that there's access to these things and just not the stigma that is associated with things like antidepressants. That can be, yeah, the stigma that can just come with that label of taking an antidepressant to help out with depression or anxiety or anything among the sorts. But yeah, those are some of the things that, again, just in my short, almost not even a year yet, that I've kind of seen as far as like breaking down some disparities.
Thank you. The next question is, what initiatives or programs have you been involved in that can improve healthcare access and outcomes? Miss Shayla.
I thought you were going to change up the rotation. It's fine. So I transitioned to this position shortly before COVID. And so since then, I think I have seen a lot of projects that have occurred at our institution. I helped with our transition from Cerner to Epic, so helping get our Midlands facilities onto that system, and was there or active in the merger between the Upstate and the Midlands to go from Palmetto Health to Prisma Health. And then also helped with, now that I do automation, have helped optimize utilization of all of our medication cabinets and smart pumps and stuff across the system. So it was one of the reasons why I decided to try to get into this position, is so I could help facilitate and I guess help, I won't keep using the word optimize, but help improve the Prisma Health organization overall. So I've been able to, been blessed to be able to be a part of a lot of projects that I feel like have made major impact to our organization across the state.
Thank you. Phillip?
Sure. So one initiative that I spoke with Brenda about early on when I first started was having the pharmacist that we have trying to round to the rooms for patient discharges. So we do a lot of discharges at the River Tower Outpatient Pharmacy. So in that discharge aspect, I really want our pharmacists and even our interns to go up to the rooms, speak with the patients. If they have any medicinal questions, we can answer those for them, and they actually see a face instead of us just being behind the counter and telling them, "Oh, come down to 1U, stop by the pharmacy right around the gift shop." So I really want to bring that comfort level back to our patients, and it's an initiative that I'm trying to work on with Brendan to get going forward. And I think this will be awesome way for my interns to learn more about ambulatory care, to actually be in front of patients, because we kind of like stuck behind a wall where I'm at. Well, not behind the wall, but behind the counter. So I really want to get our patients to see us on the floor, and I want to get our pharmacists, our outpatient pharmacists, out there on the floor with our patients, just talk to them about medications, going over things they maybe have questions about. Sometimes the nurse or doctor can't answer. I can send the pharmacist up there. We get everything going from there. That's an initiative that I really want to push forward at MUSC, and hopefully the next 6 months it'll be a reality.
And Bernard?
Yeah, I would echo like a lot of the things that I mentioned earlier as far as like the pharmacy concierge service being like massive. I wasn't directly involved in that, but I do like send a lot of referrals to them. So just increasing utilization of that service. I think for me personally, so with the sickle cell clinic, prior to me, there was never a pharmacist in this clinic ever. So coming over here, I kind of like got to build it from the ground up. And so I think that that alone is like its own initiative of trying to figure out, okay, what is a pharmacist going to be doing in this role? So figuring out, for these patients, like how do we monitor hydroxyurea? What do we need to be doing to see the efficacy or like the safety monitoring for it? And then like, having discussions with patients about their pain medications, like if we believe as a clinic, like, hey, maybe this is too much, like being able to talk with them about reducing their medication. Yeah, I think there's just been a lot of different things that I've learned about like establishing a clinic and, how different providers work, like kind of figuring out where to get my foot in the door. Because essentially all of these visits are 30 minutes. And so like a provider wants all 30 of their minutes. And so you have to essentially show like, why are you here? What benefit do you have to me? And so it's to the point now where like my provider's like, please go first, and like, come out with all your recommendations, just because like over time I've kind of like shown them like, what I do, what services I offer. So yeah, I've really felt like I've made a difference in the lives of the patients and also like the work life of the providers. And so yeah, it's been cool to kind of like create this from the ground up and actually feel like it's making a difference and like see that subjectively and objectively that a difference is being made. Just like from patient report or like utilization of like the emergency department for different pain crises. Yeah, we can see that like our clinic is definitely moving in the right direction.
All right. So we're gonna, for Shayla, I'm gonna go in reverse order this time. So Bernard, you'll be up first on the next question, and that is just how can the pharmacy profession better support and mentor our next generation of pharmacists?
Yeah, I think that's a good question. I would say that having an open door policy of allowing people to come shadow and like encouraging people to come shadow to see what you do. I like always do that. Like are a lot of times like when you're within your first year of like working, like they would like you to just like focus on clinic, like because I'm a new hire. But if somebody reaches out and they're like, hey, I have a student that wants to come check it out, or hey, I have a resident or a resident or a learner with me, they want to come check out your clinic, I'm like, come on, like bring them over. Um, yeah. And like when we have even the medical students, like I try to like chat with them and tell them, hey, like I know you're training to be an MD, but like sometimes you have to think like a Pharm.D. So like think about your dosing. Like, it's great that you have the medication in mind, but like, what if there's a contraindication? Or what if like we have to think about their kidneys? So just think about those things. Hopefully you'll have a pharmacist that'll do all those things for you, is what I tell the medical students. But yeah, again, just encouraging students to engage and yeah, having that open door policy. It's really, yeah, nice and refreshing. I remember as a student, if somebody wanted me to be there, like it's always better than feeling like I'm being a burden. Um, but as far as like the students, what you guys can do is like, show up, be engaged, be prepared. Like if you want to go shadow somebody, don't just go and expect them to teach you everything about like their disease state or yeah, don't expect them to teach you the entire guidelines. Do what you can do at home, like read through the guidelines, at least like know some of the basics about the disease. And that way, like when you go talk to like a heart failure specialist, like say you're going with Dr. Haney, he doesn't have to teach you heart failure from scratch. He can really kind of get into some of the details about like the medications and yeah, all the minutia of the disease state rather than kind of teaching you step one. So I would say like, yeah, for rotations or whether you want to do a shadowing, try to like bring what you can to the table whenever you're going into those things so you can come away with like really the clinical expertise rather than just knowing the basics.
Fantastic. Phillip?
Bernard, that was a mouthful, man. You did good, man. I like that. I like the aspect where you want the students and the people to come support you and see what you do day to day. I love that. And the key thing for me in my outpatient pharmacy, we get a lot of interns. So I get interns from UH, I get interns from Sean Jenkins, interns who come to Art, and a couple of interns on this call right now. And I always try to tell them, I want you to think like a pharmacist. I know you're an intern right now, but think how we're thinking. Find a pharmacist you can get up with and just talk to them. Ask them what do they see in what you versus what you're seeing. We got to be available for our interns and for any student who wants to interested in pharmacy. I think availability is the biggest key thing to helping our future pharmacists in America flourish, or not even America, in the world flourish. I always tell them, you got an intern from, intern looking to come by and just see what we do, or they want to get a job, tell them to apply. You don't even have to apply. Just tell you want to come by and we can talk. We can see how we do from day to day. Maybe this isn't for you, maybe it is, but it's all about the networking. I know Bernard, so I say, hey, you want interested in this? Get up with Bernard. He can put you in the right conversations with the right people. He knows the clinics backwards and out. He can get you in the right context. And I always, and another thing, I try to be available for my interns. I'm trying to, hey, we can talk outside of work. We can talk at work. It's cool. We're all good. I'm not above you. I was at your position at one point in time. I was a P1, P2, and P3, and a P4. I've seen the aspects of it. I know the challenges of taking tests and exams and having to come back and work the next day. So just come be available for me and everything. So I feel like if we're available for our interns and we let them know that we're here to help them and guide them in the right way, we've done our job. We got to plant a seed. And if we can plant seeds early from P1 to P4, we've done our job.
Thank you. Shayla?
Yes, I agree with Bernard and Philip. Just being available and as healthcare providers, just being proactive about reaching back and providing that guidance and always being available for our students or students that may come and um, just being approachable as well, and just just continuing. Don't necessarily wait for students to come and ask, but always just offering those opportunities and participating in events like this and community events as well. But I think availability is a big thing. I was a first year uh, doctor or doctorate in my family. So I'm the first person to have a doctorate in my family. So there were a lot of things I didn't know, going through school and didn't realize I didn't know. Where you say you don't know what you don't know. So certain things I didn't even know that I should be reaching out or asking these questions. So, we just offering, continuing to offer that advice. Some students may know it already, but you may be opening others up to a brand new world that they didn't realize existed before. So just supporting and, like the fella said, being available.
So the next question is, what advice would you give young individuals considering a career in pharmacy or in healthcare? And we'll go with Bernard again first.
Yeah, so I would say two things to kind of be mindful of, like at all times, whether it's pharmacy, whether it's anything. I would say be prepared and be professional. Like if you can do those two things, like those two things alone will take you so far. Just being prepared and being professional, yeah, will really serve you so well if you can just do those two things at all times. I would say other things to be mindful of, or to like try to do is to ask questions. But and I know people say there's no such thing as a bad question. I I agree with that somewhat. Somewhat I disagree with it. I think if it's a question that can be Googled, then Google it. And then like come up with your own answer first. And then whenever you're like you've thought about it on your own or looked into it a little bit, and it can be Google or it can be like a true like literature search. But if it can be Google, just Google it. And then talk to your preceptor, talk to your mentor of like, hey, I did a quick look into this and this is what I found. What are your thoughts about it? Which just goes back to the last question of like bringing something to the table and not just kind of like walking to the table with like your fork and just ready to eat. Try to bring something, whether it's, the napkins and just the cups. You may not have all the food, but try to bring something to the conversation and just do the little bit that you can. And on top of that, I think something that really served me very well as a student, as far as just retaining information, preparing for the NAPLEX. One thing that I did is every day that I was on rotation, I made it a point to write down everything that I didn't know about for that day. So whether it was a disease state I didn't know or a medication that like I kind of knew, but I didn't really remember the mechanism of action, like I would just write it down. So if I saw like oxybutynin and I was like, ooh, I don't remember how that works, I'd write it down. Or if I saw diverticulitis, I'm like, I don't really remember learning about that in school. Like maybe we talked about it, I would just write it down. And then like, and this would be like during my day on rotation. So I wouldn't be trying to do all these things during rotation. I'd just kind of be focusing on rotation. And when I would see these things, I would just write them down on a Google Doc. And like after the day was over, I would go home and I would, decompress. And then I would spend 30, 45 minutes just looking into those things. So I'd just Google, like, what is diverticulitis? Or I'd go on Lexicon and look up oxybutynin. What's it for? How does it work? And just jot down like one or two sentences on it. And, just doing this over time, you maybe pick up two or three things every day. And like once a month, I would go back through and I would look through everything that I got through like for this month and all the previous months. And I would organize it by disease state. I would organize it by different drug classes or whatnot, whatever, system you want to try, if this is something that you sound like is for you. But over time, this like just helped me retain information so much, to where the point where it came time to study for the NAPLEX, I like took a lot of these things that I had on this Google Doc and like formatted them into like the different categories for the NAPLEX. And I just like had so much recollection and retainment from just doing that. And so I would highly echo you to find some system that allows you to kind of stay up to date and look into things that maybe you're not sure on or you want to polish up on. I would highly encourage you to do that as you go through your academic career and get towards rotations and start to think about the NAPLEX and studying for that. It would really help out with retainment.
Thank you. And Phillip?
Well, the best advice I can give somebody considering a career in pharmacy, healthcare, anything, is advice that I got from somebody who told me. He said, treat everybody like they're somebody, and you will always have somebody on your side. So when you go speak to that professor, talk to their secretary, ask them how they're doing, how their day is going. You go see the custodian working, ask them how they're doing. Is everything going on with them? And that's just not like a healthcare or pharmacy related, that's just a life thing. Because sometimes some people can do more for you behind the scenes than you know about it. That secretary may put your application on top of the desk for Dr. Hall to see. You never know what could happen in the situation. So I would try to tell people, treat the president of the company just like you would treat the custodian of the company, from top down. And then in life, I feel like everything's open for you. You can achieve anything. If you just start for that level of respect for everybody and what their job is, even if it's the most menial job you ever thought in your life, if you treat them like a person, they will respond in kind. And I always try to tell my students and that, I try to tell my cousins that, my little cousins, treat everybody with respect and everything will fall into place. In anything in your life, because people are praying for you, pulling for you that you don't even know, even down to the lunch ladies in the cafeteria. You never know. You may come to that line and not have enough for food, but guess who's gonna look out? Those people will look out for you. So you just got to be able to recognize that it's not about the top of your degree. It's everybody on the bottom too. Treat that doctor just how you treat the custodian, how you treat the secretary. Treat everybody with the same level, and there's nothing you can't achieve in life. And I push that on to my interns. I push that on to my coworkers. Treat everybody good, and good things will happen for you. In regards to pharmacy, I always, and harping on what Bernard says, learn things that you didn't think you needed to learn, or come back and pick up stuff. There's been plenty of rotations. I had a rotation in infectious disease at Trident Hospital. I didn't know about what I was going through. I may have lost information, but I came back the next day and I was able to come back with it. So always learn every day and learn something new every day. And if you need help, ask for it. Some students are exceptional students. They come to school with no problems. I wasn't that student. I came to school and I had to actually learn how to study because, going through school is so easy with you. Don't be afraid to ask for help, and don't be afraid to learn new techniques and how to approach stuff. With me, I had to write everything down to retain the information. And that's how I taught myself. I had to teach myself actually how to study. I think a lot of our students are coming into school and they are the top of their class and they are brilliant. But you got to be able to put in the work. And I think that's harping about what Bernard's saying. Hey, trust, if you can Google it, but still come with your own presentation of that answer. And that's the main thing I can tell students coming in. Don't be afraid to ask for help. And if you need help with studying or need help, we have resources here at the school that will teach you how to study effectively. And that's the main thing I faced when I was a young student. And I always tell all my interns, hey, if you need help, there's available and resources there to help you progress. Because if you weren't special, you wouldn't be in this position.
Thank you. And Miss Shayla?
Yes. Excellent answers, fellas. The same thing Phillip said with like making sure you never burn bridges and just looking at people as individuals. That's something I always tell people, and to always operate in excellence in whatever space you go into. And I give an example of how I got into hospital pharmacy. It was due to a technician I had worked with when we were both at Walgreens, and she had since transitioned to Richland Hospital. But just wherever I was or whatever space I was operating in, I always looked at us as equals and always made sure to try to have a healthy work environment. And when this position had opened up at Richland, she reached out to me and said, "Hey, I know you're an amazing pharmacist. I think you need to apply for this position." And so, what would have happened if I hadn't, if I had been snobbish or arrogant or just, disregarded her or just looked at being at her store because I was floating from time to time there, what would have happened if I hadn't cared about what I was doing at that point in time. So I do stress also the importance of just treating everybody with respect and always having positive work relationships, never taking those for granted, thinking you're not going to be in a space for a certain period of time. I also, recommend that, and I think Bernard talked about this previously, just shadowing and getting out and exploring. Now is the time to try things and to make those mistakes and to find out what you're passionate about. And even if you get on a rotation or a job or shadowing experience that you don't think you're going to be interested in, and I think one of them spoke about this as well, still use that opportunity to be a sponge and absorb everything you can while you're in that space, because you don't know if you'll circle back to it, or you don't know if it'll be helpful or beneficial to you for whatever field you may end up in. So that is what I'd add to that. Those are already amazing answers.
Wow, what an amazing hour. I've learned a lot. We cannot thank our panelists today enough for taking time out of their busy schedules to meet with us and share their words of wisdom. We have certainly all learned a lot from them. We are all very blessed to have them as alumnus of the college. And again, I want to thank Bernard, Phillip, Shayla. Thank you for doing this today. We would like, they've said they're happy if you reach out to them. So please consider that. But again, thank you for your time today. And everybody have a great rest of the week. Thank you.
So thank you, Dean Hall.
Thank you.
Anytime.
Thank you.